So what do you, when you hear about AI, I feel like everybody we're talking to mentions that it has a lot of potential great uses for healthcare in the medical community. How do you see it, and how are you seeing it in your world?
Well, I think AI has the power to be transformative in our world. I don't think that's a hard thing to understand or see. But we have to be cautious as we use it. I think, as we were discussing earlier, it's not quite there yet in terms of being trained to a point where you're certain of its accuracy. And there are lots of moves within platforms to improve that accuracy. But you can see the road ahead, how it's going to help us understand, get to diagnosis quicker, help clinicians. I think it's going to be an incredible adjunct. It already is. I see how much we are using those tools to bolster our capabilities, to check, to push back, and really try to understand, to get to the most accurate diagnoses for patients. There's lots of uses, obviously, within automation and helping ease of work. We're using ambient technologies, to be able to record conversations and create the first templates of our notes so we can focus more on one-on-one time, personal time with patients. So I think it's a vista ahead of us, but needs to be done smartly so that we really include the data for all populations in the models that we build and the answers that we give.
You mean like women?
Like women. I think that's a focus of your segment today. We haven't historically done a great job of including women in clinical trials, collecting data on women, understanding. But to your point around technology, with real-time data, right? Real-time data sets on women, coupled with studies targeting women's illness, I think we're going to have a much more nuanced and personalized understanding of disease.
When? Today?
Or we have to do this. I feel like I do not want my daughter's generation to be sitting here
with the same conversation,
conversation. And I think it took the unlocking with the AI tools that are coming to us to make that a possibility.
I guess what I'm curious about is how quickly you see this happening. Not right now, and to Carol's question, when, but like, if we look at this as a moment in time over your entire career, and the way that you're seeing tech actually move the needle when it comes to what you do and what your doctors and nurses do every single day at Boston Children's, are we in a moment where we are going to see us be able to make leaps and bounds when it comes to development of new therapies for certain ailments, new diagnosing tools? Like, is this a pivotal moment?
This is 100% a pivotal moment.
Like the biggest in your career at this point?
Absolutely. It's like an industrial revolution is taking place. It's that type of moment in time, from my perspective. Yeah. I think that...
But you see stuff happening that makes you think that, right?
It's also a very important perspective for healthcare, too.
Yeah, totally.
I think generative AI was the first next milestone, right? And that was, 3 years ago, right? And then the agentic piece that's come over the last, year or two is unlocking all new capabilities. So I think that it's the evolution, and the geospatial AI is going to have its moment. So when you start to be able to understand where are the medical deserts in care, you're able to use agentic workflows across data that can bring back information that you really couldn't see. You wouldn't have the scale and the capability.
Who's building the data sets? Like, I think about that. And one of the things that I think through people we've talked to, how it's shifting to, it might not be that everybody's using these large language models, but you'll have very specific vertical data sets, especially for like healthcare or medicine, so that when you are working within it, it's a really smart, appropriate database. So who's building those databases? Are you guys doing your own? Are you working with other medical organizations? Like, how does that work?
I think it's something that's evolving.
Okay.
There's lots of data sets that have been built over time, right? In terms of electronic health records, data sets within registries. There are many data sets, and you raise the right point, making sure those are solid good evidence-based data sets that this is the data you want to be using. There's the UK Biobank. There's large data sets
Right.
that are unlocking this sort of potential. And I think we're now having this real-time data collection capabilities that is going to be very interesting to see. Instead of, say, a glucose test once every 3 months, you have a continuous glucometer running, you have continuous glucose data set. So I think of it like my perspective, my cardiac ICU. I'm dealing with continuous data streams. Now there's an ability to analyze continuous data streams in ways that were just so challenged before. So I think it's that unique moment in time.
We are told drug development is a real opportunity too. Is that true?
Yes, I think it is very much a real opportunity.
So how I mean, look, drug development's expensive. It's slow. It's high stakes. You know, you see sometimes, like, it's almost like every day the biotech companies are some of the biggest movers to the upside or to the downside. They take big risks.
Very volatile.
Does the development of AI, does it change sort of the drug development cycle meaningfully?
I think that is the hope that everybody has right now, and there are many companies that are, spinning out and doing that sort of work. Big Pharma has arms that are doing that sort of work. Think about it in terms of the rare disease space and the sort of like children that we care for, say at Children's. What an opportunity to be able to potentially bring things to market that weren't possible. And then when I think about the long-term care of patients and understanding the full patient profile, the phenotype of the disease, we have new ways of actually understanding the patient cohorts that may unlock new possibilities in terms of developments of therapies for them.
We've always talked about very individualized medicine. Is that still a thing, and increasingly that is a thing, and will AI help it so that we can look at each of us, because ailments obviously impact people differently?
They do. And I think you had Dr. Doug was on here earlier talking about bone health, right?
Yes.
And how do you personalize things to an individual? I think this is part of this moment in time that you can personalize. Your physiology is going to be different than my physiology, and maybe how I live my life needs to be a little bit different to the way you live your life.
Yeah.
Based on knowing your lab values, your genotype, your phenotype, that then we could get ahead of understanding what disease you have the potential of developing and intervening earlier such that you may either delay or not end up with that disease trajectory.
So are we there? Again,
I think it's an infrastructure build.
Yeah.
And it's not just technology. I think that's an important point. Technology is not the only thing that you need to think about in solving for this. It's, market inefficiencies, it's operations, it's regulations, and that spans the globe.
Yeah.
That we really need to think about that. And I think that's where I say we're in a revolutionary time in the sense of everything is changing, and how do we build the right and most appropriate structures?
Global health is so important to you. Just 30 seconds, in this changing the game for underserved communities, underserved populations.
Yes.
It will.
It will.
If they can get the tech, if they can
I think it's the tech that's designed for the local community. Trust, building trust. I think it unlocks the ability to, I think, a more expanded data around all of humanity, not just like a U.S. population.
Yeah.
And being able to understand, I think, how you can deliver better, more targeted care. I mean, we're already using some of this tech in terms of collaborating across geographies. I think that's one of the things that closes the distance. I mean, we personally, with the foundation, Virtue Foundation, are already using some of that technology.
And you have a book coming out later this year.
I do.
I'm just going to say, we have to wrap it. It's Crossroads in Global Health.
Crossroads in Global Health, published with me and my colleague, Dr. Ebi Elahi, coming out from Taylor and Francis in September.
You guys have to come back and then talk to us once you have the book out.
Thank you.